evening and a very warm welcome to this Unison webinar. My name is Cheryl Godber. I'm a Unison regional organiser, and tonight we're going to be exploring the North West Anglia's Foundation Trust privatisation or plans of privatising of key services, why we consider that to be unwise and what you can do to help reverse their decision on this. Just to advise that this session is being recorded so it can be shared post the meeting so that other people can see what was been said tonight. So we have an excellent panel of speakers on this topic tonight, and once they have spoken, you will have an opportunity to ask questions using the question function on your screen. We will answer as many questions as we can in the time that we have, but we will be starting to pull this meeting to a close at 5 to 8. So, talking of time, without any further ado, I'm very, very pleased to welcome Dr. John Lister from London Health Emergency, who has commissioned and has written a Unison report exploring what the Trust is planning to do and evidencing why that would be a most unwise action to take. So, John, over to you.
Thank you very much. And yes, I wanted to begin with why I chose the title from outstanding to average, because may not be immediately obvious, but it's the Trust has just recently published documents setting out what appear to be their aspirations for improving quality of the services of the Trust. And they have one which is called From Good to Outstanding. What's significant about that and some of the other recent documents about supporting staff across the Trust is that the actual non-clinical support staff, which includes catering and other support staff at Hinchinbrook Hospital who are currently in-house staff, as well as outsourced staff working in Peterborough and Stamford hospitals, is that they're not included in this at all. And what we have in the case of the services that are at risk at the present time at Hinchinbrook Hospital is that we have a catering department in particular, which has won multiple awards, which is defined among the top 10 catering departments in the country, which is delivered services in-house, catering for the needs of patients and delivering food which is cooked on the hospital site from local ingredients, freshly cooked on a day-to-day basis. Now, this is actually the model of care which the government has recently stated that they favour and that they want more trusts to move towards. So this is an outstanding service, and the Trust is now proposing to put this out to tender to private companies, which will not be able to match the quality and the outstanding level of service. So, in other words, they're moving, in this case, from an outstanding service to an average service. In other words, it's quite obviously in the wrong direction. And I'm actually old enough to remember the very beginning of the outsourcing process back in the 1980s, and the Thatcher government came forward with plans to separate out effectively what they called hotel services, that's cleaning, catering, and laundry and other non-clinical services in hospitals. And they separated them out from the clinical services. And they said these are now hotel services. They're not really the business of hospital management, and they decided to put them out to competitive tender. And we had a whole process in which, allegedly in the pursuit of savings, but obviously also in pursuit of profitable contracts for private sector contractors, which obviously were among the Tory party supporters, they proceeded to put cleaning services in particular out to tender. And nobody, I think, who remembers that time, and nobody now who looks on private hospital cleaning would regard that as a step other than to undermine quality, to break up the teams that existed on the wards, which were included the cleaning, the catering, the domestic staff working alongside as part of the same team as the nursing staff. Nobody now looks back at that as a golden age in which sort of services and quality were improved. In fact, it's become a bit of a byword for hospital-borne infections, which massively increased in the following period, And all the research that's been done over the last 35 years since that policy was introduced, all the research suggests that, in fact, the services are better when they're delivered in-house, and that, in fact, every time they're further fragmented and outsourced, you get an undermining of quality. And more recently, we've had examples in a number of major trusts in which large contracts for outsourced services for again, cleaning and catering in particular, have been brought in-house after the private contractors have lamentably failed to deliver acceptable standards of services. And these are itemized in the report. Now, it appears that North West Anglia Hospitals Trust is flying in the face of this experience, of the research, of the evidence, and actually headed in the opposite direction to government policy with its proposals to put services at Hinchinbrook out to competitive tender. And so you might ask, well, what are they aiming to achieve by that? And of course, this is a difficult question to answer, because as yet there is no business plan setting out what their objectives are in actually opening up these services to companies, which they don't actually know. There's a list, a short list they appear to be opening this to for companies, but they've decided they're not going to produce an in-house bid. So there won't be any genuine competition between the actual services that could be delivered if the services were reintegrated as part of a team across the trust, delivering services in which all staff are NHS employees and treated equally and brought as part of an integrated team. There's no competition along those lines at all. And in fact, the business plan doesn't define what they're aiming to achieve. And when we asked, Unison asked the trust to say what the key performance indicators might be in the tenders that are opening up, they haven't been able to answer that question. In fact, they weren't even able to answer the question of what key performance indicators apply to the services that are currently outsourced at Peterborough and Stamford hospitals. So this is not insignificant, because unless you have clearly in your mind what it is you're aiming to improve and whether or not you're going to actually be delivering an improvement, it's very unwise to start with an outstanding service or a service that's delivering and start to put that again out to tender with all the uncertainty that brings. So it's impossible to avoid the conclusion in the way that this has been done, in the way that the unions have only been consulted to a bare minimum degree, and most of that after, in fact, it was clear that the unions were going to contest this proposal to put services out to tender. It's clear that the trust doesn't actually value the work being done by these non-clinical support staff, despite the fact that during the COVID pandemic in particular, we've seen clearly demonstrated the importance and actually rounds of applause from the general public demonstrating the fact that their work is absolutely crucial to the services being delivered by clinicians within the trust. And we had the trust has just published a policy on COVID, post-COVID support for staff within the trust. Non-clinical staff are not mentioned in that policy. And it's clear again that they're not really included in that policy. Partly, of course, because across much of the trust, they're currently outsourced to private companies and therefore not technically NHS employees. And clearly the NHS is rather glad in this trust to actually wash its hands of them and set that on one side. And again, as I said, from the good to outstanding policy, which aims to improve the quality of the services across the trust, again, non-clinical services are not included. Now, this is in stark contrast to other parts of the NHS, and one of the more recent examples in London, a major trust in London, Imperial Healthcare Trust, which has just decided to move in the opposite direction, recognising the role that non-clinical staff play, support staff play, and they've decided to actually bring them back in-house across 5 hospital sites across northwest London, bring them back in-house in order to improve on the quality of services that the trust is able to deliver and to actually bring them and integrate them into the team. This is at the end of a 5-year contract with Sodexo, one of the major contract companies, and clearly they are learning the lesson that actually these services are better delivered in-house. It's rather strange that we have when the Peterborough Peterborough Hospitals and Stamford merged with Hinchingbrook to form the Northwest Anglia Trust, they actually achieved a unity with a major top performing catering department, one of the top 10 departments in the country, one that had won awards consistently in the last 5 or 6 years for massive improvements in the quality of food. We've got in Peterborough, and we're asking for figures to pin this down, but the Northwest Anglia Trust as a whole has food waste of 40 tonnes a year. And we're very firmly convinced that a large percentage of that will be in the Peterborough and Stamford hospitals, where cooked chill meals reheated in scaled down kitchens in the privately financed hospital in Peterborough and in Stamford. Cooked chill meals account for a huge amount of food waste across the NHS. We'd like to see a breakdown as to whether where the waste is in the trust, because we're convinced that it will not be in Hinchingbrook, where the freshly prepared food is delivered according to the orders of patients and delivered to the satisfaction of staff. And it's quite important that I've just recently had experience of cooked chill food in a PFI hospital in Coventry. And I'll tell you, a large percentage of it is completely uneatable. And you can actually witness the waste that's going on as large amounts of food is wheeled out on trolleys. By the time it gets to wards, it's lukewarm, completely unappetizing, served up in an unappetizing way. This is not the way to enhance the care of patients or to actually maximize the efficiency of the delivery of a catering service. So how anybody can imagine that moving from what we've got in Hinchingbrook to a cooked chill system, which would come in with a private provider, is anything other than an undermining of services, is a bit of a riddle. And whether the trust board is actually on board with this, again, we're not too sure, because it appears that they've not been consulted or involved in the decision to move in this direction. So it's clear, and you will hear, I think, later from catering staff themselves. Catering staff are bitterly upset and hurt by the moves that have been made here. They feel that their work is being undervalued and ignored. And we also know, of course, from other sections of the staff across the trust, they would dearly love to be part of an in-house tender that actually reintegrated staff into the NHS, treats them as NHS equals and employees, and actually brings the whole lot together into one team, as the way that any self-respecting trust would be looking to do. Matt Hancock, as Health Secretary, has committed recently to actually bringing hospital catering services back in-house. Earlier this year, with Prue Leith, as part of his campaign to reform hospital catering, he opened a £3 million investment in hospital kitchens in St Richard's Hospital in Chichester, saying that this was the model that he wanted other trusts to be following. Well, maybe he should be contacting the trust directly and letting them know, because they're heading in precisely the opposite direction. And rather than investing in actually improving the catering in Peterborough, they're looking to actually cut a few quid by actually undermining the services that are currently provided in Hinchingbrook, with the risk that they'll break up the existing team in Hinchingbrook, undermine the quality of services, but also lose the expertise and the dedication of the staff that actually put so much effort in to maintaining and improving those services. So I think this is clearly a detrimental step. Is clearly something that should be actually fully discussed by the board before any decisions are taken, and it's clearly something that should only be done in the context of a clear, explicit business plan as to what they're aiming to achieve, and also a clear comparison between what could be delivered by an in-house bid and what is on offer from the private companies that might respond to this tender. So with that in mind, obviously that my time's up, and I'll hand over to the other speakers. I'm sure we'll add other dimensions to this discussion.
Thank you, John. That was a really useful overview of the reports that you've written for us, identifying quite clearly the issues of why this decision, particularly in a COVID world, is not the way that a self-respecting trust should be moving forward. And in actual fact, they should be looking, as Unison and Unite, the two unions involved in this, want them to do, at bringing all services back in-house, so that they actually have direct control of those services, and can mobilise staff when and where they are most needed. So without further ado, I'm going to invite Linda Jones to say a few words. Now, Linda is a Labour councillor for Cambridgeshire County Council, sorry, and has been campaigning for some time against outsourcing, and wanted to come along tonight and say a few words about what's happening and give her support. Hi, Linda, over to you.
So, hi to people. I'm Linda Jones, as Cheryl said. I'm the Labour councillor on Cambridgeshire County Council, and I'm actually the group lead on the Health Committee. And my background is in public health. And over the years, I've read quite a lot of research highlighting the poor quality of hospital food and the negative impact it has on patients' rate of recovery. And it's very interesting that over the last decade or so, the hospitals have got together, and this has gradually begun to change, although it's got a long way to go. While I've been on the council, I've argued against the closure of Cambridgeshire County Council school meal service because it has had negative nutritional impact, and because also the likelihood of commercial suppliers, even if they start low when they make their bids, raising costs later on during the contracts. And it's very difficult for small schools, particularly primary schools. I've also challenged at county council level the letting of large unwieldy contracts because they're difficult to monitor. They cede, I think, too much power to big companies, some of which then frighten the people who've contracted them because they're seen as too big to fail. So for all these reasons, I'm appalled by the attempt of the Trust to decimate a trusted, high quality in-house catering service at Hinchinbrook, especially one that actually performs better than the outsourced service they currently provide across the rest of the Trust. There's, as far as I can make out, and John has confirmed this, there's been no proper business case done. So a trust is relying on unevidenced judgment that it's going to be cheaper and easier to have one major service provider. And that's some of what I was railing about in relation to the council as well. Oh, let's just contract with one provider because it's easier for us. But actually in the health sector, the evidence is stacked against this. I think it is in the council sector too. If you look at the range of large NHS providers like Carillion and Interserve and so on, in some cases, 3 or 4 years down the line, the performance has been so dire that they've had to take them back in-house. And as John has said, this flies in the face of the direction of travel, of where the NHS is actually having to move now. Because progressive trusts are bringing catering back in-house. Some are beginning to connect clinical and patient support services, including catering, which is long overdue. Matt Hancock's proposed hospital review, food review, also goes further, focusing on support for local sourcing, sustainability of whole food supply chains, and reducing reliance on packaged and frozen food. All the things that Hinchinbrook, if it contracted out on the cook, chill, serve model, would be actually moving towards. And finally, I think there is COVID. In the era of COVID-19, trusts need trusted and committed support staff who are properly paid and integrated into the NHS team. Surely the pandemic has taught us and the Trust that much.
Thank you very much, Linda, for that insight. and the work that you've been doing before. And I'm hoping that along with other councillors, we can rely on your ongoing support in campaigning against what North West Anglia Hospitals is planning to do. So thank you. What I'd like to do now is invite Sam Hemorrhage onto the call. So Sam, if you can turn your camera and mic on. Sam is our local Unison branch secretary, working at North West Anglia Trust, and very much engaged in campaigning in terms of what is happening, and what she can actually see on the ground with our members and staff that are affected by all of this. So Sam, my understanding is that you've got a personal message from our members and colleagues in the Hinchinbrook catering team. So I'm going to let you read that out.
Good evening, everyone. As well, Cheryl's introduced me as Sam Hemorrhage, branch secretary at the hospital. So the catering staff kindly sent me a message and asked if I can read this out. So here we go. This time last year, the Prime Minister and Health Secretary were in all the papers visiting and promoting hospitals with in-house catering, saying this is what we want in all NHS hospitals, freshly cooked food from scratch. Hospitals to employ their own chefs and to have less reliance on frozen meals, pre-packed salads and sandwiches. The Health Secretary even praised executives that had already bought their catering in-house, as he believes it is a safer option for patients and good for staff morale. The catering staff question why anyone should follow any rules made in these unprecedented times when trust boards can ignore both the Health Secretary and the Prime Minister. On the 2nd of July this year, the catering department's world fell apart. We was told MWAF was putting our roles out to tender. How can this be after all the awards that we have received? The government promoting catering departments like ours as a good thing. Most of the catering staff are long-serving NHS employees, including MWAF's longest-serving employee. When you have worked for the NHS for 20 to 40 years, you're not just employees, you are the NHS. Not all NHS employees wear scrubs and work on the wards. A lot work in the hospitals, go unseen by the public, but are just as important. Having this through our NHS status being so brutally taken away is devastating, humiliating, and make us feel worthless. We question, are we seen as human beings or just a number? This has taken a lot of our self-confidence and value in our very existence. We cannot put into words the pain of being part of a bidding process within a hospital we have served for so many years. It feels inhumane, yet is legal. We know that we can provide a much better quality service for the taxpayer in-house. The fact there is no in-house bid allowed shows the value the board puts non-clinical staff. The fact that the Chief Executive has not taken any time to speak with us, despite some of the country's longest serving NHS employees at risk of losing everything they have spent a lifetime achieving, shows the value MWAF puts on us. The fact there is nobody on the trust board that represents people like us shows we have no voice and no existence in the thoughts of or minds of the MWAF. We thank everyone who signed the petition so far, and we know that Hinchinbrook staff are behind us, from clinical office and even wider to the ambulance service who use the garden restaurant, the public and many more. We don't know how this will end, but we know this whole thing has been handled unprofessionally. It is ugly, unfair and not befitting of any NHS trust. A small group of people have the power to take everything away from us, but we still have our dignity, and they can't take away from us. I would just like to point out that it's just not doctors and nurses that work in the NHS. Many people work in the NHS, and after all, we are one team. The catering and the portering staff are very upset over this, and they don't know whether they'll stay in the NHS or go to be outsourced. But as Unison states, we are fighting to keep these staff in NHS because they have worked for the NHS for many years, and NHS employers are better. We need to keep staff in the NHS and get those that have already outsourced back to work in NHS. Thank you.
Thank you for that, Sam. That sort of heartfelt message from members of the Hinchinbrook catering team, which I can absolutely categorically say is across the feelings across all of those that are facing the prospect of being outsourced. We also have the issue, of course, of those people who are currently outsourced to private companies working at North West Anglia Foundation Trust, so sort of the catering at Peterborough and also mainly cleaning services are delivered by a private company. Now, I have to say, in relation to the report that Dr. John Lister wrote for us, that has been sent to the board and to the directors. And I have to say that the response that we've had back has been around the feeling that we're actually doing down people who deliver those services currently whilst they're privatised. That is not the case. We want to see those people brought back in-house, and it's not that they're doing a bad job at the moment, but we do feel that there are issues around this COVID situation that we're in that we don't feel that the trust has got direct control over. And now with the contracts coming to an end, it is an ideal time to have the conversation with us and the staff about bringing the services back in-house and creating that one team, that one NHS team once again for the trust. Without further ado, I'm going to invite, who's on my list now, Nick Johnson, sorry, who is one of our staff governors at Hinchinbrook. Hi, Nick. No, just Nick is one of our staff governors and at Hinchinbrook. So he's actually been hearing from staff on the ground, as it were, because a number of them have been going to him as a staff governor, expressing their concerns about what's happening. So Nick, if you want to sort of give us a few minutes of your time and tell us what you've been hearing. Thank you.
Thank you, Cheryl, and hopefully you can hear me as I'm speaking now. First of all, I'll just say thank you for all the previous speakers, particularly John for that excellent report, and obviously to Sam for delivering sort of the very sobering words from fellow colleagues who work at Hinchinbrook Hospital. I'm sort of speaking as a staff governor. I am a medic, children's doctor within the hospital, and I obviously thank Unison for sharing that report, which got to me as a staff governor after you sort of brought it to the attention of the board. It's quite a sobering read for me, and I appreciate obviously my organisation, you know, we're trying to be balanced about this, have obviously responded, but I'm really here for those who want to listen to kind of represent how my experience as a staff governor has sort of developed over the course of the last sort of 2 months in regard to the current situation. I've been at the hospital for about 14 years, and I'll be absolutely honest, one of the things that I chose to actually work at Hinchinbrook Hospital was because of the catering. Knowing I would have spent many a long night on call and during the day, knowing that there was always a friendly face and high quality food which I could access, was absolutely one of the reasons why I thought this is the place I want to work. That opinion hasn't changed over the 14 years that I have worked there, and obviously continue to hopefully work there. The quality of service and delivery, not just obviously to the members of staff like myself, but actually to the most important people, the patient, is absolutely second to none. I think that puts in context about how I personally feel. I have had representation from many senior colleagues, consultants like myself, who have, I know, signed the petition and have also wanted to send the message out to the members of the catering staff and to the wider public that they support this sort of pushback against the proposals. I know it's well within the rights of the organisation to kind of explore these issues, but I think it's only fair to say that I was taken aback when I was approached by members of staff from the catering department particularly, and also, you know, the other front of house, some of the very loyal portering staff, who just couldn't believe that what was being proposed was happening to them at the time of, obviously, you know, we're all very well of the COVID crisis. I could see, and as a role as a staff governor who's there to represent everybody on site, and if it's been said once, it should be said 100 times. The NHS is not just the doctors and the nurses. There are many other clinical staff, but we couldn't survive without the backroom people, you know, and that's maybe being unfair to call them backroom, because they should be front of house. They are the admin staff that keep things going. And I think it was Napoleon who once said, if an army marches on his stomach, well, the NHS army at Hinchinbrook marches on the food and what we get into our stomachs from the team that are in the catering department. So I could obviously appreciate their immediate concerns, and it was clear that they felt that they needed to be represented, of which that is my role. And I've made it clear to the board and through the services that I think not only that the staff need to be listened to and heard, and the arguments that have been very clearly put forward by John have to be really recognised, and that has to go not just to kind of the management who have been tasked with looking at the re-tendering process, but the board has to sort of take responsibility. And I have great belief that when the board hears and takes on board the report that's been given, and they hear the voices coming from the heart and soul of our departments, particularly the catering side of things, that I think things will maybe and hopefully change. I myself have already been approached to kind of be part of the evaluation process, but I'm waiting to hear back, because I felt, as has again been alluded to in the first presentation, that a truly honest and across the board clear evaluation process of all the options does have to include a let's continue as we are, or indeed, as been alluded to, the example set by Imperial NHS Trust down in London, actually a reconfiguration and a whole host of exporting the excellence that we see in terms of NHS in-house services to the wider trust. I've only recently become a member of the North West Anglia NHS Trust, and many things that have happened have been for the better, and I speak personally in terms of working across the board of the paediatric department. But in this situation, I'm really hopeful that as a staff governor, I'll be advocating and making sure that the whole board hears the voices and really looks again at some of the proposals that have been made, and maybe can reconsider significantly to even, as I said before, export the excellence I see on a day-to-day basis here on site at Hinchinbrook. And can I finally finish that once again, the fish and chips on a Friday was absolutely fantastic. So thank you to all of you.
Thanks for that, Nick. Not tried the fish and chips yet. That must be on my my to-do list. Thank you for that. That's really useful, and thank you for your ongoing support in terms of a staff governor. I speak on behalf of our members and other staff that have been coming to you, and thank you for engaging with us in terms of your thoughts and views and what you hear on the ground. It's been really useful. So thanks for that, Nick. Can I now invite finally Richard Bourne as a speaker. Richard, can you turn your mic and your camera on, please? Thank you. Hi, Richard. Richard I've been around like a few of us a long time, and I know Richard, though I didn't work with him, didn't have the pleasure of working with him at that time, but I know Richard was involved when Hinchinbrook Hospital was privatised to Circle, and what a disaster that was. So Richard, I know you were one of the campaigners at the time. I think you may well have written us some research as well. So can I hand over to you for a few minutes to sort of go through your thoughts on all of this and your experiences? Thank you.
Thank you for inviting me. As you say, I've been around for a very long time, almost as long as John, and I work for Unison nationally, have done for many years, all over the country, mostly on negotiations around outsourcing and privatisation, and more recently over the dreaded subcos. The last 3 years, a lot of engagement around that. As you say, yes, I was there at the birth of Hinchinbrook, that brilliant experiment with the private sector that we told them would collapse, which it inevitably did. And it just goes to show that the private sector doesn't actually have the answers to everything. But I did actually come back a few years later and took part in the negotiations at Hinchinbrook when they first tried to outsource all of these services. And along with some people who were quite helpful from Unite, Unison led the negotiations, and we were up against this kind of crack team from the private sector. But we wiped the floor with them and they withdrew the proposals. And as you have said, the services have been very good ever since. And I mean, the number of times I've seen this over the country, time and time again, being involved in very similar negotiations. The trusts go forward, they haven't done a proper business case, they haven't consulted with the staff, they've never done any kind of proper options appraisal, let alone appraising the option of bringing services back in-house. Half the time they haven't even consulted with their own board properly. They often break their own procurement rules in going ahead because they don't do anything properly. And time again, we've come up against similar problems of negotiating with people, especially around the FM services. But the message I'd say to you is we've had a lot of success. When we get in the room, when we can put the kind of arguments that John put so well, which Linda emphasised so well, we can actually demolish the case that management put forward, which is inevitably very weak for the reasons that were given. And I was also very impressed by what Sam said. And in another trust fairly recently in Bradford, where we negotiated, a couple of members of staff actually presented to the board of directors in a very similar way to the way Sam did. And we think that was one of the most important factors which eventually convinced the board to completely drop their proposals in Bradford. So I'm going to say to you that if you can get into the right arena, if you can mobilise the staff, if you can begin to draw on the support of people like the staff governor, if you can draw on the local community to support you as well, these things can be beaten, it can be defeated. The case is actually very weak. The arguments that will be put forward don't stand up to a strong analysis. So I hope very much that you are able to do that and you are able to persuade them once again, as we did a few years ago, that actually this is a very stupid idea and it doesn't actually fit with anything within which the wider NHS is trying to do. Thank you.
Thank you, Richard. Some wise words there, and yes, we will continue to attempt to get into the right arenas and have the conversations, the meaningful conversations around this and the options that we feel that the trust should be pursuing. But thank you for your insight and joining us tonight. Now, I've had a comment come through from one of our colleagues who works at Hinchinbrook, and just to remind really that catering department are not the only people affected, and you know we do appreciate that, but also the patient services and the portering department. And it's been pointed out that they're sometimes called the unsung heroes, and absolutely I totally echo that. And you know, the report that we've produced is about all services, as well as catering. So on that note, I guess well, that's all the speakers for tonight. We no doubt will have further meetings if we need to, public meetings, and we'll let you know about that. But I just wanted to let you know, bring you up to speed where the trade unions, because there's 2 trade unions involved in this. This is Unison and Unite, and where we're actually at with this and what we're doing in pursuing this campaign against the outsourcing. So obviously we're liaising with stakeholders, anybody that's got an interest, which is as you can imagine, is a wide range of people, whether it's community groups, Health Watch, local councillors, etc. So we're doing all of that kind of work. We're obviously in constant touch with staff and our union members in terms of what's happening on the ground and how they're feeling, and trying to support them through this, but also let them know that we're absolutely there for them. We will be fighting alongside them against what the trust is wanting to do. And we're also talking to the trust. We are in dispute with the trust. That dispute process is not concluded, but they are starting to have conversations with us and share relevant information. There is still no business case for any of this what they're going through. The process has started, and they are refusing to stop the process whilst they have conversations with us. So that is where we're at. Now I'm hoping, if technology allows, I can now share a screen with you that will go through what you can do to sort of help with this. So green light's on, so I'm hoping that people can see this. So what can you do in terms of this campaign? So you can sign our online petition if you haven't already done so, and share the life out of it. That petition link can be found at Unison on the Unison Eastern website. On the front page is where it should be. For those of you that weren't aware, North West Anglia have got an AGM meeting on the 6th of October next week, so Tuesday. It starts at 6:15, and I believe goes on till 7, so not a very long one. But in addition to turning up to the meeting, we are asking people to send in questions about this issue and any concerns that you have before midnight on Sunday. That is the deadline that the trust has given with regard to this. Sorry, I don't know what's happening here. Just hang on a minute. Okay, I'm just going to continue. This slide will be sent out to you, so that after the webinar, so that you can do the actions. Send in the questions. Talk to colleagues. Talk to your friends, your relatives, people that use the services currently on any of the hospital sites, about what's happening, and that there is an opportunity here to put pressure on the trust to do the right thing. And you can also contact Sam and colleagues at the local Unison branch, and there's their address there as well. As I say, we will send this out. I'm going to stop sharing the screen now because I'm not quite sure if people are being able to see it. Anyway. So in terms of the rest of this meeting, it's over to you really if you've got any questions that you want to ask, and that would be good. I see some questions are coming through. Okay, one of the questions that's being asked is what can we do to support the campaign? Well, I've already outlined some of those, the things that you can do more or less straight away, and I hope that people will take the action to sign the petition, turn up at the AGM meeting, which is a virtual meeting, and also send in questions about and your concerns about all of this process. And if you feel that you can contribute more, or you've got some ideas around campaigning on this issue, then obviously contact the Unison branch at the email address I gave earlier, and will be sent out to you subsequently. There will be other activities that we will be sort of publicising as time moves on. And if you see those advertised on Facebook or on social media, or even in the local press, because we are engaging with the local press on this, then please do feel free to get involved. In fact, I would strongly encourage you to get involved. The more people that get involved, it just puts pressure on the trust to reconsider what they're actually doing. Is this a done deal? Well, I think Richard Bourne sort of highlighted that that no, it's not. It's not a done deal until a contract has been actually awarded, and then we would still campaign anyway. So just to give you an idea of timescale, they are intending to award the contract in December, January time, and the contract, the new contract, if they continue with this, is planned to start on the 1st of April. And the chances are we will have at least another 5 years of contracted out services, and in fact not just the current contracted out services, but a lot more as well. So I'm just checking to see if there's any other questions. Right, there's one question that's come through. I don't really know the answer to this, but why is the Chief Operating Officer actually handed his notice in at this point in time? I don't know the answer to that. It's certainly a question that we can ask. I don't know whether it's linked or whether it's for personal reasons, but we can ask that. Are there any more questions, please? Okay, there's nothing coming through, so thank you for your attention tonight and for your time as well. I know it's a Friday night, but at least having a public meeting virtually has meant nobody's had to sort of travel out in the cold and the rain, so we've been able to sit in the comfort of our relative comfort of our own homes and engage with this, which is really good. So I just want to say thank you for joining us. We look forward to your continued support in this campaign. It is an important campaign, and I am now going to close the session. Thank you.